Well, good afternoon. We here again, Anna.
Hi, Karen. Again, my name is Anna. I'm the breastfeeding counselor here at the WIC office. And we are here again with Karen.
Yes. Well, everybody know my name is Karen. If you don't know, well, I need to say it again. We're here again with Anna now in English
Yeah,
information.
we are in English information.
We're going to try our best to give you all those information. And any question, please let us know. Hopefully, you can be enjoying with us and asking questions. And we're going to do our best, right, Anna?
Sure. There you go. Just hope and for any questions, just ask right now. That way we can help you. But just remember, always call the clinic, and then we will be able to help you as well.
Yes, and also remember, we have the classes, the virtual breastfeeding classes, Monday to Friday, English and Spanish, and just give us a call and let us know. We can able to help you to the pregnant mommies, mommies they are breastfeeding also. So we just waiting. Hopefully, they connecting. Anna.
I know. Let's see who's gonna be asking the first question. But just remember, Karen, I was we need to let everybody knows too. Like with this COVID-19, we all has to have the precautions and everything has all to take care of the family. Make sure that you always use your face mask
Yes,
and
exactly. Like
wash your
us.
hands. That's very important. And just waiting and see for the question. See if you can help.
Yes, hopefully. I know the more common question, Anna, is about COVID-19 and breastfeeding.
Yes.
What do you think? We can able to do any information about it, and that way we can wait if it's some mommies connected and able to asking more questions.
Yeah, we're gonna start with doing that anyway. The most common question, Karen, then they normally ask if mommies with COVID-19 diagnosed can be breastfeeding. What do you think?
Yes, Anna, it's important to mommy to breastfeeding, especially if they know they have COVID-19. The breast milk is producing the antibiotics, right? And that's really helpful for the baby body. So that's why we recommended to continue breastfeeding. Always take the, how do you say, the, what do you need to do is cover your face. Put a your mask, washing your hands. That is really important to do, especially when you're planning to breastfeeding or if you planning to pumping. Really important to clean it up the pumping, or the part of the pumps.
Yeah, it is important, mommies, if in case you have been diagnosed with COVID-19, remember you can still breastfeeding your baby. You can still breastfeed your baby, but just always make sure that you do the wear face mask and wash your hands. You can still breastfeeding your baby directly on the breast, but if you don't feel comfortable to do it, let's pump, like you say, Karen. Mommies can pump in the same process. Wash your hands. Make sure that you, when you touch the pump, all the parts, sanitize the pump, and then wash it well. And then provide the breast milk to someone is not diagnosed with COVID-19. That way, that person can provide your breast milk to baby. Okay, and according with the Center of Disease Control and Prevention with CDC. Remember, you can still breastfeeding, but you can always talk to your doctor, and that's very important. We are here to help you and give you all the information that we know, but you always talk to your doctor. Okay?
Yes, and also call us if you concerned or you're not sure. Call us back here at the week location, and we can able to help you. We have lactation counselors in different location a week. But that is the most common question, right, Anna?
Yeah, that's the most common question that we are having right now. And another question that is very common right now too, Karen, is that most people, most mommies, they always tell them, or they always ask why the breastfeeding, why every time that I latch my baby is really painful. And
That's true.
that's another question that we always hear from mommies. Um, common question, the most common question that they always ask. What do you think, Karen? What can we tell them to those moms?
With those mom, they have like a problem when they're breastfeeding, especially they say my nipple is sore or is painful or is sometimes they can bleeding a lot.
Mhm.
It's because they don't put the right position to the baby. We always recommend it to put the right position. Make sure the baby mouth is completely open, and put all the nipple inside of the baby mouth, and that way the pain can be less, because breastfeeding they don't supposed to be painful. They're supposed to be something beautiful, enjoying with your baby, like that connection that you
Yeah.
make with the
Hmm.
baby.
That is right.
Yep. So I don't know what else that you can able to see
But
to
something,
say.
another thing for those moms, pregnant moms, those future mommies, or these moms they are breastfeeding right now in this moment, just always make sure that you enjoy the moment. Do it skin to skin. It's another thing that will help you latching your baby and positioning your baby correctly. That's another fact that can help you. But the most important is to try to latch the baby correctly. And if your baby, if this has been more than a minute or more than 2 minutes, please remove your baby, because that's telling you the baby is not latching correctly, not supposed to hurt. Maybe you can feel a discomfort in the beginning, which is normal, but no pain. Okay, just if you feel pain, just ask for help. Okay.
Yes, you can call us back here again. We can able to help you. Really, because we want to see mommies to enjoy the breastfeeding without any pain. Okay.
Yeah.
We're still waiting, Anna.
Yeah, we need to see some questions and see if
Yes.
they can get connected. Please just get connected and see if we have questions.
Let me double check, Anna.
Mhm.
One question. Guadalupe. Yeah,
Yay!
Guadalupe. Thank you
That's
for
it.
being here. Say hello, ladies. Yeah, Anna.
Yay! Hello, Guadalupe.
Yeah. How can I know if my baby is getting enough breast milk?
Oh,
No,
that's a
that's a
good.
good question too. What do you think, Anna?
How do you say, how can I know if my baby is getting enough breast milk? That's a great question. Something very important, mom, is then in order for you to know how well your baby is eating, if it's only breast milk, make sure that you always track dirty diapers. Okay, that's very very good to check. Track that, because babies after the 5 days of life are supposed to get between 6 to 8 dirty wet diapers and 2 to 3 dirty diapers. So that will tell you. Another thing that can help you know how well baby's eating is getting weight. Remember, we are here to support you, to help you, and in case if you have any questions or you're not sure if your baby is getting weight, you can call us. We can schedule an appointment and we can weigh your baby to make you feel comfortable and see how baby is doing.
Is
Okay.
getting weight. Yes. Another thing is sometimes when the baby is enough, when it's a little full with the breast milk, sometimes the baby put it out the nipple,
Mhm.
right? Like by himself. So that's the another a signal that the baby can able to make, and you can able to see, oh, my baby is full now, so I need to stop breastfeeding. But like Anna say, always pay attention. The if the baby is poop, and let us know, because that's why we're here to able to help you for any question or concern. Good question, Guadalupe. Yes, we have Alejandra.
Alejandra,
Yes,
yeah, Alejandra,
Alejandra.
yay.
Thank you to be here with us,
That's
with
it.
Anna and Karen.
Thank you for the support, mommies. And the question from Alejandra is, can it possible to breastfeed twins?
Oh my goodness,
Yeah.
how do you say,
It's a very challenge,
challenger? Yes,
but yes, you can do it,
yes.
Alejandra. You can breastfeed a twins. However, just remember that most we recommend is like it all depends how comfortable you feel breastfeeding your baby. Just the position. If you breastfeed your baby constantly and both at the same time, you can do it. But just always make sure that you drink plenty of liquid. But definitely you can exclusively breastfeed your baby, twins baby. Just be patient, okay?
Yes, and the position I believe can be comfortable for twin, like a football position.
Mhm.
Yes, that
Yeah.
way you can able have more control of the baby head and able to put it closer to the breast. And that way the baby able to start sucking, eating. It's a little difficult, but it's not impossible to do. And yes, you can breastfeed in the twins, drinking a lot of water, like Anna said, right?
And something very important, Karen, is to mommy, just believe in your body, believe in yourself. If you are doing all the steps that you need to do, you can do it. You just need to be positive that you gonna breastfeed your baby for these amounts. And believe me, if you put that on your mind and then trust your body, you can do it. Okay, Alejandra? So thank you for asking that question. And remember, just drink plenty of liquid, keep latching your babies, and your body will produce that milk that your babies need. Okay? Thank
Yes.
you, Alejandra. You're
Yes,
good.
Alejandra, thank you to be here again with
Cata-
us.
You see, that's right.
We have another question, Catalina. Yes, welcome, Catalina.
Yay!
Thank you to be here. And the question is, could tell me if we can eat a special food to produce more milk? What do you think, Anna?
Okay. Catalina, thank you for being here with us today. You don't have to drink or eat any special food. The most important, Catalina, is to make sure that you latch your baby on demand. Drink plenty of liquid because this is the two things, the most important two things that you need to do. However, yes, your eating diet, it is important because you need to eat your fruits, vegetables, and another thing can be helpful is rest. Take a rest. I know when mommies have babies or when we have babies, it's not easy. It take time, it take patience. But if super mommy, yes, but that super mommy need to take a rest. Mommy need to take a naps if it's possible when babies sleep. So the best way to produce more milk is to keep latching your baby on demand and keep drinking plenty of liquid and plenty of rest as well. What do you think, Karen?
Yes, like you say, Anna, because if the mommy is so stressful, your body is not going to produce the milk that you want to see for your baby. So it's really important, like Anna say, try to rest. We're going day by day. Don't pretending that we are super mommies.
I know,
Because
but this is the
sometimes,
most,
yes, sometimes we think like we are super mommies. We are not super mommies. So especially after the baby born, taking you time, going day by day, drinking fluid. Alejandra, I see she put how much water that I need to drink. Most of the time, Alejandra, is every time that you're breastfeeding, you're going to feel thirsty,
the
right?
majority.
That yes, and that's the way that you need to say, oh, I need to drink water. So drinking water, rest. You can able eating healthy meals. Eat you 3 meals: breakfast, lunch, dinner. Sometimes mommy they say I lost my appetite, but I always recommend to mommy try to eat something every time that you breastfeeding the baby, right?
Yes, but it is important, Alejandra, that latching your baby, but we recommend at least 8 glasses of water a day. But it all depends on how you feel. Just drink when you are thirsty, not because we're telling you to drink this amount of liquid. You're gonna do it, but just make sure that you drink that water when you are thirsty. And most of the time is every time that you latch baby, you will feel thirsty. So this is the time that you're gonna be drinking water. But it is important to always keep your body hydrated. Okay, so just keep latching your baby and keep drinking enough liquid. Okay.
Yes, and that way you can able to see how your body is going to produce the milk that the baby need.
That's right.
Thank you for those questions. Thank you to be here. So
Yay!
exciting.
I know. Thank you for being here.
Yes, we have another question for Guadalupe. Do I need to prepare my nipples to start breastfeeding? Most of the time, always ask that question.
Yes.
Right? Why do you think they asking that question, Anna?
Definitely, they just need to know and see if your baby need your nipple has to be ready for once you deliver. But Guadalupe, let me tell you, you don't need to prepare your nipples to start producing milk or to start latching your baby. What you need to do is like just remember your nipples. They have the Montgomery glands. Then normally they always keep your nipple hydrated, and then you don't need to prepare your nipple because once you deliver, you just need to make sure that you position your baby correctly. That way you can avoid any nipple soreness, any nipple pain, things like that. But you do not need to prepare your nipples at all. Just be confident and ask for help if you are having any problem latching your baby. Okay.
Yes, just remember, your baby is the one who's going to help you to stimulate the breast, I mean the nipple, and that also they help you to the gland to start producing the milk, like Anna say. So you don't need to do nothing. It's basically the baby is the one who's going to help you to start producing the milk for the baby. Just enjoying the moment, and if in that moment you have question concern, give us a call because that's why we're here, right,
Exactly.
Anna?
That's why we're here to help
Yes.
you, to support you.
To
And
support.
the most important too, Karen, is for those mommies who are there breastfeeding or they're pregnant. Just remember, just accept any help because mommy need help too. Any support from the family. And then if you have that support and you still have questions, we are here. We are the breastfeeding counselor from
Yeah.
different clinics, and will be happy to help you. Okay.
English and Spanish.
Yeah,
We
English
try
and
our
Spanish.
best.
We do the best. You're
We
right.
have another question, Vanessa. Yeah, Vanessa, you're
Yeah.
here with us.
Thank you
Thank
for
you
being
so
here,
much. Yeah,
Vanessa.
for that support. We need that support because that's the way we can able to learn. Because we also learning, right?
Yeah, that's right. We
Yes.
always learning every day.
Vanessa said, let me read it in Spanish. Mi bebé tiene 16 meses, aún le doy pecho. La doctora me dijo que ya no tiene nutrientes. Mi leche que deja de dejarle mm,
Dejarle de dar,
de dar ese,
¿es cierto?
¿es cierto? You wanna
Okay, what Vanessa question said, then her baby is 16 months right now and she's still giving breast milk. Yay, good job,
Yes.
Vanessa. That's great. And then her doctor is telling her to stop breastfeeding because that milk does not have no more nutrients. And then she say, is that truth? Vanessa, we recommend 1 year of breastfeeding. Even if you go more than a year, you can still breastfeeding because your milk still have nutrients. Just remember that if you always taking your prenatal vitamins and eating well, healthy fruits, vegetables, all the nutrients that you need, your body will still producing the benefits for your baby. However, it's not going to be the same thing because your milk will take depending on the baby's age. Like the first year is one, the nutrients are going to be there for your baby, but even after the year, those nutrients are still there, but your baby is a different age, so your milk change. So just remember, you can still breastfeeding as long as you want, as long as you and your baby decide to keep doing that. So it's your choice, Vanessa, if you want to stop breastfeeding or if you want to continue. But for my opinion, just keep doing what you're doing, mommy. You're doing a great job. Just keep doing that, okay?
excellent job. And remember, in that time, Anna, the baby probably is just breastfeeding in the nighttime or
Yeah.
in the morning time. It's not like before or in the beginning that was more often. So your breast milk, like Anna mentioned, they always producing the antibiotics. And that's really helpful, continue helpful for the baby body. So continue doing it. If you wanna to do it, and when you're thinking to take it off, just do it slow down. Don't do it right away, and that way the baby cannot be upset because sometimes babies can be upset.
Yeah. Just take a time.
Taking your time,
It's a patiently, but it's slowly you can do it. But if you want to continue, go ahead, Vanessa. You can continue breastfeeding your baby. Okay, you're doing a great job. Just keep in mind that. Okay, keep in
Yes.
mind that you are doing an excellent job. Good, kudos to you. Okay, good.
Yes. We have another question.
Catalina said, my friend is telling me if I have my baby with C-section, I will not able to breastfeed my baby because I will take medication. What do you think here?
It's not true, Catalina. You can continue breastfeeding even if you're taking any medication. Right now, it's a lot of medication is safe for you and for your baby. Always check with your doctor. That way they can able to change the medication, and that way you can continue breastfeeding. That's why it's important to breastfeeding on demanding. That way you can continue establish your breast milk, continue producing the milk. Also, we had the especially lactation, right? And also we had the medication book that we can able to double check, and we can give it to you that information. That way you can able to talk to your doctor too, and that way it's going to be more easy for you to taking any decision if you wanted to continue breastfeeding or if you want to stop breastfeeding. But don't stop right away. Just ask question. Try to call us back here and let us know how we can able to help you. What do you think?
But the most important, Karen, is like for Catalina, um, ask doctor that you are planning on breastfeeding. That way they can give you some compatible medicine that can be able to breastfeed too. I know in the beginning, because of the C-section, that can cause medication, how you call anesthesia. But once the anesthesia goes away, you can still breastfeed. You can start breastfeeding, but just talk to your doctor, Catalina, and ask and that you are planning on breastfeeding. Please just provide a medicine that is compatible with breast milk. That way, I can continue breastfeeding my baby. So you can breastfeed even if you have C-section, Catalina. Okay.
Yes, yes, be patient because in the beginning it's not easy, but it's not impossible to able to continue doing it. Okay. We have another question, Mariela.
Mariela, yeah.
Mariela, thank you to be here, Mariela. And they say, what can I do while I'm breastfeeding? Am I lost?
I think maybe she's tried to say in loss of appetite. Okay, Mariela. That's a good question. You can, if you are breastfeeding, great job. You're doing a great job.
Yes.
But the most important, Mariela, is to, even if it's little portions, just try to eat because this is the thing. If you don't eat a small portion, so at least to eat something, you will feel tired, you will feel weak, and that's not good because remember, your baby is taking all the nutrients from your milk, breast milk. So it is important to keep eating, even if you feel like that you don't want to eat. Just eat a small portions and do it mostly for both of you because you need to be healthy and you need to keep your baby healthy. And the best way to do it is taking a small portions and keep latching your baby. What do you think, Karen?
Like snacks, right?
Yeah.
She can eat like a snack. Smoothies. Sometimes mommy say I'm not hungry right now, but I'm going to make my smoothies, and that's really good because you eating your vegetables, your fruit, and like Anna say, if you not eating at all or lose your appetite, you need to put in your mind, I need to eat because my baby need my breast milk. Otherwise, are you going to be tired, sleepy?
Yeah.
Yes. So it's really important. But excellent job that you breastfeeding. And just remember, try to eat something, little snacks that can help you to you a lot. Okay.
Little by little, Mariela, but just always include some food in your diet, okay? Because it's important for you and for your baby as well.
Yes, and thank you for that question, and thank you for be supporting to us.
Hey, good job, mommies.
Yes, we had Doris.
Doris,
Yes,
Doris. It is, Doris' question said, it is possible to breastfeed a newborn baby and at the in the same time continue breastfeeding 18 months old toddler.
Yes.
Good question,
Good
Doris.
question.
And let me tell you, you're doing a great job if you are having your baby and you want to continue breastfeeding your toddler. Definitely, yes, you can do that. Okay. You know, that can help Karen because when a toddler, it is stimulating the breast, it's stimulated more.
Better.
And then baby keep producing milk. But just remember, just keep in mind that your toddler does not need that much breast milk. So even though the baby, the toddler, your child help you stimulate your breast milk, the most important is to always offer the breast milk to your newborn, because your newborn is the one who need the breast milk the most. Okay, but you
Yes.
can definitely breastfeed both together. Okay, you can do it.
Yes, and take
Okay,
a picture and send it to us. That way we can see the little one and
and
the
the toddler
yes,
breastfeeding.
and that way we can celebrate with you, Doris.
Yeah.
Yes,
But that's a good question, because most mommies, they feel like then they cannot breastfeed after having a newborn. But yes, mommy, you can breastfeed a toddler and newborn baby. Okay. But just
yes,
remember, your newborn baby is the one who needs the most breast milk after you decide to breastfeed both.
yes,
Okay, but good job, Doris.
yes, Doris.
And there is Guadalupe asking if there is any risk for me or my baby if I don't breastfeed. Okay, good question. What do you think?
Yes,
Okay.
Guadalupe is a risk. The risk is a little more higher. The one for baby they are breastfeeding. When mommy decide to not breastfeeding at all, and the risk is a little more higher. Like they start bleeding a little
Mhm,
more.
mhm.
They can be also breast cancer or ovarian cancer later in life. The risk is a little more higher. Also, it's hard to losing the weight.
Yeah.
They taking a little more longer um, when you not breastfeeding at all. I don't know what else we can tell the mom.
Yeah, Guadalupe, the risk for not breastfeeding your baby or for yourself, the mostly Karen explained, the risk is very important, because um, you have the risk to get of ovarian cancer, like you say, breast cancer. Breast cancer is the common illness that is affecting us, all of us. So the more you breastfeed, the less chance you have to have those kind of
Yes.
problems. For your baby has great health, especially avoid when you breastfeed more. Your baby has less chance to have allergies, like diarrhea, constipations, uh,
Allergies
um,
for baby.
allergies, yeah, for
Allergies,
babies, and then
asthma,
also asthma, ear infections. They
ear
is the one
infection.
that affect the most for babies, and also later in life, you can prevent to have diabetes,
That's true.
also heart problems. All those illness are prevented if you breastfeed your baby more. So just keep in mind that your breast milk is natural. It has all the nutrients that your baby needs. Okay,
Yes, and the
that's the benefit.
benefit is for mommy and baby,
Yes,
not only for baby. So, that's why we encourage mommy to breastfeeding, taking your time to breastfeeding. But excellent job, Guadalupe, asking
yeah.
those questions.
And Vanessa said, "Thank you so much. God bless you. God bless you too,
God bless
Vanessa,
you
and
too
thank you to
for
be
being
here.
here.
Anyway, to
Yes.
be here. That's it. That's thank you for being here and help us. Okay, and Sandra say, oh,
Oh,
Mariela.
Sandra. Oh,
Mariela
Mariela.
said loss of appetite. Yeah, the one that we were explaining to you, Mariela. Just if just take your time and then eat some small portions like the way that we explained it before. That is important for your health and your baby's health. Okay, so just
Yes.
as little by little, and if you can do it, just talk to your doctor. I would recommend you just to talk to your doctor and see what the doctor say, if it's anything else that you can do in that concern. Okay, but just keep in mind that just eat small portions, and if you cannot do, talk to your doctor and see what he or she recommends. Okay.
Yes. Really
Um,
important to put in your
but
mind.
thank you,
Yes.
Mariela, to ask those questions and to be
Yes.
here. And then Sandra Rubio asks, "Can I
Sandra,
breastfeed
thank
my
you to be
infant in
here.
my 2 years?" Yes, Sandra, thank you. And the
Uh,
question is similar to the one that Doris asked,
yes.
Karen, if you notice that. Um,
Yes, you can able to breastfeed in both babies. Just remember, like Anna explained it before, really important the little one breastfeeding more often because he's the one who need a little more. The older baby It's good because they continue stimulate the breast, and that help you to continue producing the milk for both of them, and your body is going to produce the breast milk um, exactly for both of them, right?
Exactly. And just remember, Sandra, your 2 years old, your toddler now is getting all her nutrients, his or her nutrients from food. So that's what is important anyway, to always keep eating healthy and keep feeding, eating your babies, feed your baby with all fruits, vegetables. But just keep in mind that you're, like Karen said, your infant is the one who need the breast milk more, even though you can still breastfeeding on him or her, but just your baby is the one who needed the most. Okay, and but good question, Sandra. Thank you for being here, and then thank you, Guadalupe, for being here too. And then Alejandra, Karen, is it is possible to lose your breast milk supply?
Yes, especially if you in stress or depression. Sometimes mommy had depression or too much stress. They can able to lose a little bit of the breast milk, but that's why we recommend it to mommies. We going day by day, drinking fluid, eating healthy meals, and if you continue to put the baby on the breast like a little on demanding, and that can help you to produce the breast milk what the baby need. I don't know what else.
Another thing important, Karen, is like it is possible to to lose the breast milk supply if mommy is not latching on demand. If a mommy is not breastfeeding on demand and not stimulate those glands to produce milk, that's when the milk supply decrease. So that's what is important, to breastfeed your baby on demand, drink plenty of liquid, and take enough rest. And like you mentioned, Karen, stress, worries, all those things can affect your milk supply. So please try to relax. I know we all going through a stress in this life right now, but just think positive, believe in your body, and then keep drinking plenty of liquid and keep latching your baby on demand. Will be the best way to always keep producing milk for your baby, Alejandra. Okay.
Yes, and call us back if you need to talk to us or for any recommendation or for any support. And that way you can see you're not by yourself. We're here to help you and to give you that support to you. But thank you again for that good question.
Yeah, I
Anna.
know.
My
Yes,
goodness.
thank you, ladies, for being here and ask those questions. That's very important.
We have
And
Catalina.
yeah, Catalina.
Another question. Do you think we find I do 50-50 breastfeeding and formula because I am planning go back to work after 3 months?
Okay.
We recommended, Catalina, that is the perfect time if you thinking to pumping. Before that you thinking of formula, try to thinking if you start pumping because that is the perfect time that you can start pumping and left the breast milk for your baby when you're not at home. So I recommended before that you thinking formula, try to thinking to start pumping. That way you can start how to say collecting no not collecting
Storage the breast milk.
storage the breast milk. What do you think, Anna?
And Catalina, that's a good question, Catalina. I know one of the worries is returning to work, but you can still breastfeeding exclusively even if you back to work. Just remember, your body will get adjusted the way that you're gonna feed your baby after returning to work. Just always make sure, like Karen said, start pumping. If you're planning to return to work in 3 months, just start pumping after the month. We always recommend to start pumping and start storing your breast milk, because it's important first to stimulate in your body to produce milk, to establish your milk supply in order for you to start pumping. And the best way is to start pumping after the month and start storage your breast milk. Remember, your breast milk is good in the fridge 4 to 5 days, and then up to 6 months in the freezer. And then just remember, the hottest part of breastfeeding is the first 6 months, because babies need only breast milk during that time. And then after the 6 months, your baby will start eating a combination of breast milk and solid food. However, it's your decision, Catalina, whatever you choose. But we recommend you that if you can breastfeed only that will be the great for your baby, great for you, but it's your choice. It's nothing wrong to do that, but if you can do the first 6 months breastfeeding exclusively, you can complete the whole year. But you
Yes.
can do it, Catalina.
Yes.
You can do it even if you return to work. You can still breastfeeding exclusively. Okay,
Yes.
just be patient and believe in you and your
Yes.
body.
Yeah,
Okay.
you can able to do it, and it's only for a few months that
Yeah.
she's going to be like
Yes.
that. After
Yes,
the
you.
baby start able to eat the baby food, it's like a little release,
Mhm.
right?
Exactly. And remember, Karen, it is important that when mommies return to work, they need to breastfeed the baby before they leave the
Before,
house.
yes.
And as soon as they get home, they breastfeed the baby. And during that time, that 8 hours period, working hours, it is important to pump
To pump.
3 times if it's possible. If not, at least 2 times. But talk to your
Supervisor.
supervisor and the jobs they can allow you to breast pump. Okay, so
Yes.
keep in mind that too, Catalina. Okay. And I think that we have a few minutes. Karen, I think then we have another question up from Guadalupe. Say, do I need to take my prenatal vitamins while I'm breastfeeding? What do you think, Karen?
Yes, Guadalupe, it's really important to continue to do that because your body need those vitamins. Plus, also you eating your vegetables, your fruit. But it's really important to have like a extra help or
Extra nutrients.
extra nutrients
Yeah.
for your body because remember your body is producing the milk for the baby. So really important to do that. Okay.
Yes, Karen, it's important that mommies continue taking prenatal vitamins. Like you say, baby is taking all the nutrients from mommy. So mommy need to recover those nutrients along with foods, fruits, vegetables. That is important to keep taking the prenatal vitamins. So good question, Guadalupe. You can still taking your prenatal vitamins while you breastfeeding.
You're
Okay.
breastfeeding your baby. Yes. Wow, the time goes
That's,
fast.
I know the time is we're running out of time. Mommies, if, I hope that everything the what the all the questions that we're asking here were answered. And just remember, just call us if you are having more questions or concerns,
Concern.
okay? Because we are here to help you all.
Yes, Monday to Friday we here. We have the classes, and those virtual classes. We enjoy it to do it, and that way we can able to continue help you to you mommies. So give us a call back. We here for that support that you're going to need. Thank you to be part of this celebration.
I know.
Yeah.
And remember also we having the baby run on Saturday. Just enjoy that. Just be part of that. Just we waiting for you, all of you, on Saturday. Okay. Thank you for being
you.
here. We really appreciate. Enjoy the rest of your week. Okay. And thank you very much. All right. If you are
Yes.
interested in learning more about WEEK, just call us at 301-762-9426.
Yes.
Thank you
Thank
all
you.
for being here. Yeah, bye bye.
Yes.